I'm looking at two X-rays, dorsiplantar, DP, and oblique views of the left foot. Now, first things first. I can immediately see that there's something off about the Lisfranc joint. Normally, this joint should be aligned, but here I'm seeing lateral subluxation at the base of the third metatarsal. This means that the third metatarsal is not where it should be. It's shifted laterally compared to the medial border of the lateral cuneiform. On the oblique view, there's also misalignment between the medial borders of the second metatarsal and the middle cuneiform. This subtle misalignment strongly suggests a Lisfranc injury, which can often be missed if you're not looking closely enough, but it's super important because this injury can lead to long-term disability if not treated properly. On the DP view, there's also a lucent line extending from the distal surface of the middle cuneiform in the sagittal plane. Now, this is significant because in the context of trauma, it's highly suspicious for a fracture. Given the instability of the Lisfranc joint, this finding would definitely make me concerned about the possibility of an underlying fracture. The Lisfranc joint is located at the midfoot, where the metatarsals articulate with the tarsal bones, specifically the cuneiforms and cuboid. Injury to this joint, whether due to a fracture or just ligament damage, can severely affect the stability of the entire foot. The alignment I'm seeing is abnormal, and because of the extent of the subluxation and the potential fracture line, this is not a simple injury. It's likely unstable, and the patient will need further imaging to determine the full extent of the damage. I would urgently report these films and ensure that the referring clinicians were aware of the injury right away. This patient needs to be under the care of an orthopedic surgeon, and they may even need a CT scan to get a clearer look at any fractures that aren't immediately apparent on the X-ray. Now, if I were in the exam setting, I anticipate the examiner might ask, how do you assess the alignment of the Lisfranc joint on X-ray? Well, you look for the alignment of the medial borders of the first and second metatarsals with their respective cuneiforms on the DP view. On the oblique view, you want to check the alignment between the medial borders of the cuboid and the fourth metatarsal. If these lines are disrupted, that's a red flag. They might also ask, what's the significance of the Lisfranc ligament in this injury? The Lisfranc ligament runs between the medial cuneiform and the base of the second metatarsal, and if this ligament is damaged, it can lead to instability of the entire midfoot. That's why it's so important to recognize this injury early. Another potential question could be, what are the treatment options for a Lisfranc injury? If it's stable, it may be treated conservatively with immobilization, but an unstable Lisfranc injury, like the one we're seeing here, typically requires surgical intervention. That's why it's crucial to assess whether the injury is stable or not, which will depend on both the imaging and the clinical presentation. All right, that covers this case. I hope you found that helpful, and don't forget to hit the subscribe button on my YouTube channel, Radiology Made Easy, so you can keep learning with me.